Let's now focus on the stories that are making headlines at this moment, and we begin with the latest from the Ministry of Health, which is now saying it is focusing its efforts in the search of a viable vaccine to fight Covid-19. In the daily briefing, Health CAS Rashid Aman revealed Kenya is among the 7 countries that will be participating in clinical trials for at least 60,000 people before the end of the year. This comes as he warned of a spike in infections in social gatherings as the festive season kicks in. The latest statistics reveal 551 people have tested positive for the virus from a sample size of 4,675 samples. Nancy Okware starts off our coverage tonight with that update.
The race for a viable COVID-19 vaccine has peaked, with Kenya joining the UK, Brazil, South Africa, Japan, United States and India to participate in vaccine trials for 60,000 people in collaboration with Cambridge Wellcome Trust, AstraZeneca and Oxford University.
Initially, 40 patients. The trial did kick off. I think it was covered in the media. The first 2 patients who received their doses. And it is progressing well in terms of recruitment of patients. Beyond those 40, there is a possibility that we will be moving to larger numbers, maybe up to 400 subjects.
Aman says Kenya was working closely with other countries in Africa to ensure access to the vaccine once it is ready and certified.
Low and middle income countries are working together to be able to access these vaccines when they become available.
However, experts warn that caution is still needed as there may be a limitation in terms of distribution owing to storage requirements.
Pfizer-BioNTech vaccine is one that has issue with the supply chain because it has to be transported at ultra-cold temperatures of minus 70, 80 degrees centigrade. That could be a limitation in terms of its wide distribution, particularly in certain settings. Chadoc's vaccine has an advantage in that it can be distributed under the normal supply chain conditions that we use for our vaccines here.
Probably the vaccine that will work best for us is the AstraZeneca Oxford vaccine. But we are not closed to that particular space only. We are in discussions with other countries, including China. Any other potential vaccine will be analyzed for the 3 characteristics, that is, safety of the vaccine, its immunogenicity or the ability of the vaccine to trigger an immune response, and of course its efficacy.
And as efforts to save the world from the pandemic continue, 551 people tested positive for COVID-19 after 4,675 samples were tested. This placing the cumulative number of confirmed cases to date at 84,169. The ministry noting that COVID-19 containment measures were being flouted in places of worship, funerals and weddings.
We shall not get tired of reminding you to strictly adhere to the containment measures as our first line of defense against the virus.
5 patients have succumbed to the virus, pushing the number of fatalities to 1,474. Another 266 patients were discharged after making full recovery, with the total now standing at 55,610. 1,275 patients are admitted in hospital, with 71 in the intensive care unit and another 18 in the high dependency unit. Nancy Okware, Channel 1 News.